Asurgeon has admitted marking his initials on the livers of 2 patients during transplant operations. Consultant Simon Bramhall, 53, pleaded guilty to a charge of assault by beating at Birmingham Crown Court after being accused of branding one man and one woman's livers with SB during transplant surgery in 2013. He also pleaded not guilty to alternative charges of assault occasioning actual bodily harm. After Bramhall's pleas were entered, prosecutor Tony Badenoch QC said the Crown accepted the medic's not guilty pleas in a case which was without legal precedent in criminal law. Bramhall, who appeared in the dock wearing a pink shirt and dark suit, was granted unconditional bail and will be sentenced on January the 12th. The incidents took place while he worked at Queen Elizabeth Hospital in Birmingham, where he was a liver, spleen and pancreatic surgeon for 12 years. Liver surgeons use argon beam coagulators to stop livers bleeding during operations, but they can also be used to highlight the area of the organ due to be worked on. It is not harmful and the marks usually disappear by themselves, but when the female patient had a follow-up operation, doctors saw they had not healed and saw the initials there instead. Judge Paul Farrar allowed Bramhall to stand in front of the dock in the well of the court as the surgeon pleaded guilty to assaulting a patient whose name is protected by a court order during an operation in August 2013. He also entered a guilty plea relating to an operation performed on an unknown patient in February of the same year. Addressing the court after the pleas, Mr Badenoch said, "This has been a highly unusual and complex case, both within the expert medical testimony served by both sides and in law. It is factually, so far as we have been able to establish, without legal precedent in criminal law." The barrister added that Bramhall was employed as a consultant surgeon in Birmingham at the time of the transplant operations, and that both patients had been under anaesthetic. The pleas of guilty now entered represent an acceptance that which he did was not just ethically wrong but criminally wrong, Mr Badenoch told the court. They reflect the fact that Dr Bramhall's initialing on a patient's liver was not an isolated incident, but rather a repeated act on 2 occasions, requiring some skill and concentration. It was done in the presence of colleagues. Describing the offences as an abuse of position, Mr Badenoch said they had been carried out with a disregard for the feelings of unconscious patients. His acts in marking the livers of those patients were deliberate and conscious acts. Suffice to say, for current purposes, these pleas meet the broad public interest. He was suspended by the University Hospitals Birmingham NHS Foundation Trust after the allegations came to light. A spokesman for the trust told Mail Online he no longer works there. He resigned in 2014, with the trust commenting at the time. During the course of an internal disciplinary investigation into the conduct of Mr Simon Bramhall, the consultant liver surgeon has tendered his resignation, which has been accepted by the trust.